In lung cancer, timing is everything. Stage 1, lung cancer, we treat it with curable intent. That is completely different from late stage 3, stage 4, where curable is just not possible. I remember Lori quite well. I do remember her chest CT and the very high risk suspicious pulmonary nodule.
My primary sent me to get tested, and when the test came back, it showed the spots on my lung. And they said, well, you need a biopsy. We found out it was cancer on the day before Thanksgiving.
Chris, did you ever think through all of this that there could be a potential of Mom not being around?
Not ready for that. To be sitting here now, almost my 10th month since this started. The test said I was clear of cancer. Next step, immunotherapy. Because yes, it could come back, but it's not here now. We're gonna live life now.
Good morning, Laurie. Good to see you.
I smoked since I was 12 years old.
So listen to your lungs.
No judgment was ever passed. That's the key if you want anybody to come in and be treated.
For the next cycle of immunotherapy. Diagnosis of cancer brings a lot of stress to the patient and to the family. The worst time of their life. As a member of the cancer care team, I bring hope.
That'd be awesome.
Very good, very good. What we see from lung cancer perspective, catch them early, there is a high chance for cure. When Dr. Rotan has biopsied something which is suspicious for cancer, then he immediately calls me. I tell him, come, I'll see them the next couple of days. How about here? The communication is a major part. In the bigger systems, sometimes you lose that.
The fact that I can diagnose someone with cancer, get a biopsy, quick phone call, and have the patient in within the next day or two, having a conversation with that oncologist who is now the expert, that is life-changing. We have all of the highest technology, so I use the ion endoluminal system, which is a robot. This robot really revolutionized the field of lung cancer detection. It allows a pulmonologist to take biopsies from inside the lung itself. I go in there looking to find an answer, and I find an answer. The diagnostic yield is very high, and the complication rate is extremely low. A lot of my colleagues, my mentors, they were just astounded that Stillwater, Oklahoma, my hometown, we have this technology available. So many of my patients had just neglected that part of their health because the only option was to get on a highway and drive. And that's a big deal for a lot of these folks.
If I were a patient, if I get treatment locally, I want to be close to my son, my family. I want patients to know the best treatment, standard of care, is available locally at Stillwater Cancer Center.
It is an absolute honor working here where I grew up, and hopefully we can leave a lasting impact on the citizens of this town. Anyone who has significant smoking history, having shortness of breath, anyone who has incidental findings, or if they just can't sleep at night because they're worried about that, I encourage them to come see me.
When I first found out I had cancer, I said, I'm going to Stillwater. It was the best decision I made.